You're listening to Not Just Fluff, pet wellness from Banfield Pet Hospital, hosted by me, Hannah Shaw, animal advocate, otherwise known as the Kitten Lady. If you're like me, you love your animals a lot, but they can't talk, and it can be tough to know what they really need. Not Just Fluff is here to provide you with actionable tips and science-backed advice from reputable professionals who really understand pet care. I can't believe we are wrapping up season 1 of Not Just Fluff. These conversations have been so fun and informative, with a lot of important takeaways that I've already been employing in the lives of my own animals. I have to admit that I started this season as a cat lady through and through, but thanks in part to these conversations, I've officially turned to the dog side. I recently brought home my first forever dog, a little Chihuahua named Birdie, who I adopted from a local county shelter, and she's fitting in great in our home. But the experience of being a first-time dog adopter really brought into focus the impact that these conversations with veterinary professionals have had for me and hopefully for you too. When we brought home Birdie, her health was not in optimal shape. She had untreated epilepsy, respiratory illness, she wasn't vaccinated, she wasn't spayed, and her teeth were a hot mess. I'm so happy that after a few vet appointments, she's now spayed, vaccinated, microchipped, and on the medication she needs to be seizure-free. And you guys, she got a dental cleaning. We didn't even know until she was under anesthesia that she actually had a root abscess in one of her upper molars, which was causing so much discomfort. So it was amazing to see that once that tooth was pulled and the abscess treated, she was like a new dog. I had to ask myself how much of her shy behavior was really just pain. I just wanted to tell this story quickly because I think it sums up what this show is all about. Prevention is key, and taking your cat or dog to the vet can reveal issues you didn't even know were there. So truly, being able to lean into the insights from the veterinary professionals I spoke with this season has been very impactful for me. And I hope that you've also managed to find some nuggets of wisdom that inform the way you care for the animals in your life. I want to thank the guests who came on the show to provide insights into preventive care. Money Iyer, Dr. Kate Hilson-Tager, Dr. Michael Piccioni, Dr. Saskia Bogman, Dr. Megan Gilhooly, Dr. Andrea Sanchez, RVT Jennifer Rodin, Dr. Latoya Templeton, Dr. Maria Ramirez-Gorton, Kim Van Syke, and Lacey Frame. In this episode, I'd love to take some time to reflect on some of my favorite moments from season 1. Let's start at the very beginning, the adoption phase. As a rescuer of neonatal kittens and puppies, I obviously love baby animals, but we definitely don't need more of them entering our shelter system. This is one of the many reasons it was so valuable to speak to Dr. Maria Ramirez-Gorton about spaying and neutering our animals. If you're thinking about adopting, the spay-neuter conversation is an essential one. And I particularly enjoyed hearing Dr. Maria bust some common myths and misconceptions about spaying and neutering and the effects on behavior.
Whenever I speak with some of my clients and they have their little puppy and they love who they are and their behavior, I always say the spaying or neutering process isn't going to change any of the good things that you're seeing. What we're doing is we're potentially circumventing some of the more negative things that we might see as, like you said, these are natural behaviors that come from the mating process that they're not really getting to do in a natural way. So you do see with cats, they spray, they're territorial, and they mark their area to say, this is my territory. And once it's learned, it's very difficult to train that out of them. When you've got some pets, the male pets, they're trying to escape to mate. And so you have dogs that will jump fences, or if you have an unspayed female 2 houses down, they can smell that a mile away. So you do have a lot of that escape behavior. There is some negative behavior. I'm not going to say that all unspayed and unneutered pets are going to have bad behaviors or have behavioral problems, but there is some behavioral issues that come with some of that excess testosterone that they really don't need, isn't beneficial. Even the female behavior, certainly every time they come into heat, we'll see sometimes a little bit of guarding behavior. Maybe they're not as pleasant, they're not as sweet. There certainly are some of those behavioral issues that it's important to spay and neuter them for those reasons too.
One of the reasons Banfield Pet Hospital created Not Just Fluff was to help animal lovers advocate. A big part of that advocacy work is preventive care. which is a topic we explored a lot over this past season. It's easier and can be less expensive to practice proactive versus reactive care, like we learned from Dr. Megan Gilhooly.
I'll boil it down to very simple terms, which is proactive versus reactive. Proactive care is always easier. And for the pet, that means that they get to go home happy and healthy. For the client, that means that they get a peace of mind and also their budget, right? They're able to budget for that care. But at the end of the day, and for the veterinarian too, like let's not forget the veterinarian. For the veterinarian, that means that we can catch things early and therefore we have better ability to treat things, which is what at the end of the day, we all went to school for, right? Is to be able to advocate for those that don't have a voice.
Because our cats and dogs unfortunately can't talk to us, it can be challenging to know if and when something is wrong. For a lot of us, parasites are a concern, and I learned so much from my conversation about parasites with Dr. Michael Piccioni, including the importance of regular heartworm tests.
The early warning signs, unfortunately, is nothing. And so I will get clients that come in, like I mentioned earlier, with their pet, and they're just coming in for general wellness exam, physical examination, and other care like a once-a-year heartworm test. And the dog, or in some cases a cat, may come up fine, no concerns at home. But when we run that test and they show that they're positive, it's, everybody is on full alert. But to answer your question specifically, as that disease progresses, many patients can have cough or exercise intolerance. But unfortunately, again, some very non-specific signs that owners may not be in tune to at home to realize, hey, that is obvious heartworm disease.
Yeah, you mentioned how much these symptoms can kind of go unnoticed. And I think cats and dogs are really masterful at hiding their symptoms. And I wonder how often you do recommend that people test for heartworms, or is it something that you wait until you're symptomatic, or is it something that it's like every single animal should receive these tests, on an ongoing basis? For people who are kind of concerned, like, do I really need to be preventing this, or should I just wait until it comes up? Like, isn't it expensive or annoying to have to do ongoing prevention? Can you talk a bit about like the difference between preventing external parasites and treating them? Is it actually more cost effective to prevent?
It definitely is 100%. And I say that because we think about not only the direct effects of the parasite. So say a tick or a flea, yes, they can take blood away from an owner's pet. And obviously that's not good. But you also have to think about some potential not unrelated side effects, but things you don't think of. So other diseases, because fleas can carry diseases, ticks can carry diseases, and those diseases can be transmitted to that pet. And so for me, when I have these patients that come in, that's why I stress so much the prevention aspect of it, because some of these diseases, once they're transmitted to that pet, you can't always treat it effectively. Prevention is just so important. And so in the long run, to answer the question, yeah, prevention is well worth it in the long run.
When there's a preventive practice we can engage in from home, it's a huge win. Dental care for our animals is something that can truly have a cascading effect, right down to the animal's ability to get proper nutrition, as we learned in the very beginning of this season from Dr. Kate Hilsentager.
I saw a 5-year-old little bitty Chihuahua on Monday, and he was coming in for an oral surgery recheck, and I didn't perform his surgery. Instead, he'd seen one of my colleagues at the hospital 2 weeks prior, and he'd come in, and he was this darling little cute thing. And he'd had all of his little incisors in the front on his bottom jaw removed because they had gotten pretty infected and wiggly, and it healed up beautifully. And when I went in to talk with his owner, the conversation was, well, he's gained weight and he's super energetic and he's so happy. And it was just one of those stories where I was like, I can't tell you for sure that it was the oral pain of those loose teeth making him not want to eat very well. But all the signs are pointing that way. And he's been kind of quietly suffering with it. And so she was really happy with his attitude. I was really happy with how well he healed. And then we spent a good 5 minutes talking about how to start brushing his teeth. So it was a fun adventure. They are notoriously difficult to pinpoint that it is dental pain. Like I've had pets come in for acute, like day one of not eating. And on my exam table once, I had a dog spit a molar out on the table. And he had only stopped eating that day. And then there was a lot of other stuff going on in that mouth, a lot of oral surgery needs, but that one tooth was really bothering that day. And it was loose enough that he spat it out. And so I would say it's subtle often that they're having oral pain. Like they might notice that there's a change in how they're chewing, or they might be dropping food. Most of the time they just tolerate it, which is sad. And so when I do find things for a patient who's here for a routine dental and I find something abnormal, I do like to preface like, it's not an emergency. Your pet's been hiding this for some time. Now let's make a plan. And so trying to give people, just because there's that, as pet owners, we want to do what's best for them.
Now that you understand why it's important to keep your cat or dog's teeth healthy, what should they be chewing on? And what shouldn't they be chewing on? Our animals are playful, curious creatures, and play is a huge part of healthy development for them. But some of us might be surprised to discover that the classic toys we typically associate with animals, like tennis balls for dogs or balls of yarn for cats, they are not the safest choice. I loved learning from Dr. Saskia Bogman about some tips and tricks to find suitable toys for our active and playful pals.
So that's always such a tricky topic, unfortunately, because there's so many things on the shelves that may not always be good for your pet. As far as cats goes, like you mentioned, they love string and yarn, but really they just also love to ingest it. So I wouldn't recommend any of those for our cats. You can look into maybe the little rolling balls or one of those toys like the wand that you can kind of wave around with them. But if it's something that they can ingest, I would never leave it unsupervised with them. And as far as our canine patients, it's really common for people to want to feed them antlers or bones in the holidays. But I highly advise against them because we see tons of dogs who have fractured their upper chewing teeth because of the antlers and the bones. So general rule of thumb is if you hit it against your knee and it's too hard, then it's too hard for your pet to chew on. Or similarly, if you can't indent it with your fingernail, it's too hard for your pet to chew on. Tennis balls, they're fun and dogs love them. But unfortunately, when they get dirty, it acts kind of like sandpaper and grinds down their teeth. The strong chewable toys, those are also really good. So I really like those toys. And again, careful with any rope toys. They love to pull it apart and then ingest the rope. So
while we definitely want to make sure our animals aren't ingesting rope or anything else harmful, what we do want is for them to have a healthy diet that's right for them. I really enjoyed speaking with Jennifer Rodine about the importance of diet and exercise for our furry friends.
We can first of all determine where the pet is at on the body condition scale. We can help them prioritize healthy activities for their pets. They make active feeders for dogs and cats that encourages them to move while they're eating. We can also encourage owners to do regular walks and even things such as doggy daycare. If the owner has to work all day and can't do walks, take them to a doggy daycare. We can also help them track their weight. So it's important that we get a baseline on where the pet is at, decide where we need it to be, and track their progress. Are we making progress? And are we making the progress we want to make? And if we are not making that progress, what adjustments do we need to make to get there? We can also help owners change their habits. A lot of the extra calories that we feed our pets is because of begging. And my dogs are no different. One thing we can do is if our pets are used to getting a treat every time they go into their crates or every time they go outside, cut that treat in half. You're still giving a treat, but they're getting less calories by doing it. So just subtle changes that can make big differences. We also want to find an appropriate food for them so that they can lose weight and still have the proper nutrition that they need in the process, whether that be a therapeutic diet or a non-therapeutic diet. And again, measuring out the portions, calculating out how many calories they need in a 24-hour period, and then determining how many calories are in the food and the treats so we can come up with a plan for that.
I had the pleasure of speaking to so many knowledgeable guests this season, and if there was one thing I came away with that touches every single one of these discussions, it's that having a strong relationship with your veterinary team is vital, not only for the animal's health, but for your own peace of mind. It's so important to be able to ask questions and to build trust with your vet, as we heard from Dr. LaToya Templeton.
I would argue be your most authentic self, so that way I can make sure I'm meeting your needs where they are. So for me, did I come out and say hello? Can you recognize me from a lineup? If you have a puppy, right? What kind of food should he be on? What's his ideal weight as he grows up? Should he be on joint supplements? Is he allowed to go outside? If you have a kitten, I have another cat in the house. Little things make a difference. What kind of toys is okay for them to play with? Are they on heartworm prevention? One of the things I love about Banfield from last year and this year is our focus on heartworm prevention. Every pet, every time, what kind of prevention are they on? And if you can't pill your animal, it's okay. We have shots or we have topical therapy, but it's critical. And I want to make sure that you guys, the clients, feel it's as critical as we do as veterinarians, because it makes a difference in their overall health.
Yeah, you keep bringing up asking questions, and I think that is really important. I think it can be intimidating for someone. They've never been to the vet. They feel like, oh, I don't know what I'm talking about. I don't want to stupid, but there are no stupid questions when we're caring for our animals. Yeah, we want to be comfortable.
And you're an adult, so you feel intimidated. Like, I've got this license. I've been to medical school. No, this is your dog, right? Sure. I want to make sure I'm meeting your needs. Like, I'm interviewing for you because you're going to do all the legwork at home. Mm-hmm. So I want to make sure when you come to see me, you're telling me the truth and we're able to fix the problem, because otherwise we're going to miss each other. And that's really not the goal. So ask questions and make sure you feel comfortable with the answers.
There were so many important lessons from this season, we couldn't begin to fit them into one recap episode. So if you haven't already, I invite you to go back and listen to season 1 of Not Just Fluff, so you don't miss the many valuable insights from our guests. I know I'll be thinking about these conversations every time I pick out the right safe toy for my dog, or take my cats in for blood work, or schedule a dental cleaning. More than anything, I hope that this season has helped you to value the relationship you have with your vet and empowered you to seek the best possible care for the animals in your life. Thank you so much for listening to Not Just Fluff. If you have a question you'd like us to answer in season 2, reach out to us at podcast@banfield.com, and we just might answer it on a future episode. Thank you for listening to Not Just Fluff, pet wellness from the pros at Banfield Pet Hospital. Make sure to get your paws on the like and subscribe buttons so you don't miss an episode.